This is Dr. G here with naturalfoodsdiet.org. So let's say a person, like many in our culture, has become morbidly obese, and because of toxins, stress, a nutrient-poor diet, lack of rest, and emotional problems, they've gained weight. Now, is the answer to slice them open and then either surgically or with a laparoscopic band reduce the size of the stomach so it's the size of your thumb? Good idea, right? So the logic here is let's leave the causes in place and barbarically cut someone open and force the weight off. So what are the justifications? Well, sure, it isn't the best option, but it will reduce healthcare costs, right? Wrong. A new study of 30,000 cases reported in JAMA Surgery in 2013 shows that the healthcare costs are actually higher for a surgical patient, that's in the long term, compared to a morbidly obese matched control that didn't have surgery. Now, this doesn't even take into account the cost of the surgery, and that's usually 20 to 30 grand. So besides the high cost, what are the other downsides? Now, some estimates are that there's roughly 1 in 200 that died during the surgery or from the complications of the surgery. Now, 10% need a second surgery. Another study found that about 40% of patients had problems ranging from diarrhea after eating fatty foods to hernias and intestinal leaks. That's internal intestinal leaks. Now, many develop abdominal pain, and that's because of the adhesions or scars from the surgery internally. And because gastric bypass shrinks the areas of the digestive tract that absorb nutrients, patients can develop nutritional deficiencies, and they must take vitamins for the rest of their lives. Now, even though the average patient loses a lot of weight in that first year, fewer than 10% of the patients achieve their normal BMI, and that's a BMI of 18.5 to 24.9. Most are gaining weight back after the first year. Now, with those dismal statistics, it might not be surprising to see that a review of 17,000 weight loss surgeries in Pennsylvania showed a large increase in suicides over the expected level in the population. Now, could it be that the unreasonable expectations are smashed by side effects and failure? The person feels there's no other way out. Now, my suggestion for those contemplating this procedure are this. Now, just think about this. After the surgery, you'll need to be on a very strict program. You'll have to be virtually obsessed with what and how much you can eat. And you'll be taking all kinds of supplements. So here's my suggestion. Do the same all-out program, but without the surgery. Become totally obsessed with detoxifying, eating natural foods, getting good rest and sleep, taking supplements, especially supplements you specifically need, and also boost your thyroid and adrenal function if that's needed. You should find out about hormone imbalances in your metabolism, and you can do this with a natural medicine physician. The program I use to get to the root cause of health problems of all kinds, including overweight, is to do a hair mineral analysis. This can identify imbalances in your nutrition, toxin overload, imbalances in gland function. It can even look at the root cause of your emotional problems. Then you have a program you can hang your hat on. Now, this program that I do is called nutritional balancing. Is it easy? No, it isn't. But surgery isn't easy either. But in the end, you'll more likely be restored to good health, and you'll have very low healthcare costs going forward. Check out the website naturalfoodsdiet.org for more details on our program. This is Dr. G. Thanks so much for watching.